Before positioning the patient, ensure that the coils and the cables are in proper condition. Defective coils can cause localized burns. Discuss with the patient possible allergic reactions to the contrast medium. This is especially important in the case of pregnant women and lactating mothers. While positioning, be sure not to trap any hair or crush extremities. Always ensure there's sufficient separation between the patient and the magnet bore. Always use the appropriate positioning devices for the safety and comfort of the patient. The patient should be positioned so that the legs and hands are not touching. They can form electrical current loops that act as antenna for the RF energy. Local burns may result. Permanent makeup, tattoos and tattooing on the body must be documented and can be covered with damp compresses. Although this type of body decoration is not a contraindication, the patient must be informed that heating or distortion effects may result in the corresponding area. The same applies for other conductive materials, such as dental braces and body piercing jewelry. If the patient feels localized heating or burning sensations, the exam should be stopped. Provide the patient with hearing protection, headphones or earplugs, to safeguard against the noise level during the exam. When connecting the coils, ensure that cables are routed properly and are not touching the body. While positioning the laser-like localizer, patients must keep their eyes closed. Patients receive a squeeze bulb to hold. They can call for help anytime by pressing the ball. The exam can be interrupted immediately. Make sure that clothing and coils do not hang over the patient table. Sedated and helpless patients must be looked after by a nurse or a trained healthcare professional, and must receive physiological supervision for the entire duration of the examination. Switch on the intercom's listen mode. Before the exam, ensure that both the squeeze bulb and the intercom are functioning properly. MR technologists must be able to see and hear the patient at all times to monitor the patient properly. Now you can start the exam. Our medical products are developed and produced according to state-of-the-art technology and meet all relevant international safety standards. Most MR systems can operate in two modes: normal and first-level controlled operating mode. These modes are shown on the device. If one or more device parameters, such as gradient fields or high-frequency fields, are not in the normal operating mode, the patient has to be medically supervised, since certain groups may experience physiological stress. Exams may be performed by qualified and trained personnel only. Don't forget to brief persons such as rescue workers, firemen, workmen, and cleaning personnel who may be near the magnet for a short time only. In addition, inform personnel that smoking and open flames are not permitted in the vicinity of the magnet.
Hazards and emergency procedures. Emergency. To react properly, you have to be able to identify the type of emergency. In case of an accident caused by the electrical equipment, or in case of damage, press the emergency shutdown switch. In this example, the switch is located at eye level near the entry and exit points. Use it to disconnect the imager electronics from the line voltage. This does not turn off the magnet. If the patient is, for instance, caught between the gantry and the patient table, the table stop button must be pressed immediately. The stop button for the patient table is found on the right and left patient table control units and on the intercom. Pressing the button releases the brake so that the patient table can be moved manually. In the case of an extreme emergency, presenting risk of bodily harm and death, press the magnet stop switch immediately. The field strength rapidly decreases to a low value. This does not apply to permanent magnets. In this example, the magnet stop switch is above the emergency shutdown switch and is differentiated from it by the magnetic field label. Time saves lives. It is essential that you are informed about the appearance and location of the emergency switches right from the start. Also make sure that external personnel, such as rescue workers, are briefed as well. Be aware to use only MR-compatible equipment. The emergency shutdown switch and the magnet stop switch may also be installed at different locations on the system. Operating personnel can find sufficient information in the manual to create suitable emergency plans. Emergency. Press the switch appropriate to the emergency or accident. Evacuate the patient immediately. Inform the rescue workers of danger of magnetic field. Only use MR-compatible equipment. Document the emergency or accident. In case of a life-threatening situation requiring the immediate dissipation of the magnet, press the magnet stop switch without delay. This will quench the magnet. This means that superconductivity breaks down and the magnetic field is dissipated within around 20 seconds. Helium escapes noisily through the quench pipe. Due to the low temperature of the helium, skin contact may result in considerable injury. If possible, leave the examination room with the patient prior to pressing the magnet stop switch and inform the service department immediately. A quench is quite expensive because the escaped helium has to be replaced. Quench. Patient and MR personnel vacate room immediately. Inform your rescue workers immediately. Inform your service engineers immediately.
For this reason, take the recommendations for operating personnel seriously and ensure regular maintenance of your equipment. Create emergency plans that describe the measures the patient, personnel, and rescue workers should take in response to potential dangers. Conduct regular emergency exercises with groups. Provide precise documentation of the emergency. Provide non-magnetic tools for cleaning, service, and emergency personnel. If you are aware of the effect of the magnetic field and observe the safety instructions, MR is a safe modality for a quick diagnosis. It affords unique views of the interior of the human body without ionizing radiation.